Hi everyone, welcome to the Breast Open Capsulectomy with Silicone Implant Risks and Complications page. I'm Dr. Colin Hong, a plastic surgeon here in Toronto, and I want to take a moment to help you clearly understand what this procedure involves. While many patients are pleased with their results and experience improved comfort and appearance, it's essential to know that every surgery carries potential risks. Some of the possible complications may include implant rupture or leakage, often silent, may require replacement, capsular contracture, scar tissue tightening around the implant. Infection may require antibiotics or implant removal. Bleeding or hematoma, changes in nipple or breast sensation, implant displacement or extrusion, visible wrinkling or rippling of the implant, scarring or delayed wound healing, anesthesia-related risks, and in rare cases, serious complications like pulmonary embolism or persistent pain. It's very important that you take the time to carefully read through this page and also review the full informed consent document available under the informed consent section. Please remember, this isn't meant to scare you. It's meant to help you make an informed, empowered decision. Do your due diligence. Understand that this may not be a one-time surgery. Breast implants are not lifetime devices and future surgeries may be required. If you have any questions or concerns, I strongly encourage you to reach out to me or my qualified staff. We're here to help guide you every step of the way.